So the federal government reintroduced a nationwide 12 a.m. to 4 a.m. curfew to curtail the further spread of COVID-19. Many Nigerians are questioning the rationale behind the shutting down of businesses and restrictions on social and religious gatherings. What are your thoughts on this? Many, someone like Shrine took for a long time.
Or shut down.
They shut down for so long and they adhered to the rules so strictly. And now that you're just gradually trying to restart.
Open up again.
They are telling us to move back. So, I don't even know where to start from, YK. But generally, what are your thoughts when you heard about these new restrictions?
I said they have come again. That was my first. Because first and foremost, as far as I know, the restrictions have never been removed. As far as I know that the 12 to 4 a.m. curfew has been there. Because if you're out, you will see police. By 5 minutes to 12, you see police waiting for you so that they can arrest you.
Wow.
I have seen it. Not that they told me, I have seen it. So that 12 a.m. curfew was. So why are they saying, oh, we're just starting it? Now, states took the decision on their own to allow, because they can see what it's doing economically to their states. Because remember when Okonjo-Iweala said our GDP was what it was then? It's from the work of it's not from the government. Now, what they're doing is they're killing the GDP. They're killing the
small businesses.
One. Two, they're not helping them to grow after the killing. You're just saying, close down. I don't care how you eat.
As much as we like to say, don't shut down the economy, don't do this, don't do that. But if, God forbid, this thing happens such that we now have another third wave, there will be really no economy for us.
Okay,
so it's being preventive, and I think part of our role here is also to remind Nigerians of how important it is for us to begin to adhere to these guidelines.
So according to stats, Nigeria has so far recorded 165,419 cases of the virus, out of which 2,000 have died, while 156,000 have been discharged.
On record.
On record. So if you see the numbers we have compared to the 200 and something million that we have, I think there is no cause for alarm. I've always said this, that we do not know how long this virus is going to be here. We need to start learning to live with the virus, to live with it, to handle our businesses with it. There are countries that did not even have one lockdown, and they were able to come out of it. Countries like Switzerland, not one lockdown, and they were able to come out of it. So instead of locking down today, people are struggling, there's hunger in the land, businesses are not thriving. Those people who finally came out of the lockdown are just finding ways to stand up. You now introduce another partial, whether you call it partial or not, it's affecting businesses. We have a lot of insecurity in the land. That insecurity was even made more open and more, when we had COVID-19, because people had no jobs, and they had to the criminals had to resort to the stealing, the kidnapping, and all of that. You lock us back in, we are going to implode.
So we had to call Dr. Japhet, because when we hear government saying all these things, Dr. Japhet, we know he's our own. So we'll find out from him.
Tell us the truth.
Dr. Japhet, are you there?
I am here with you. Good morning.
Good morning. Good to have you. You see, when it comes to COVID matters,
good morning.
we can always know that you will tell us, please, what is it that the government is seeing that we are not seeing? Is there something that is happening that you are not telling us?
It is due to what is happening all over the world, actually. I think the government is just trying to be proactive instead of reactive. So that is what is going on. Now, the federal government is also planning to roll out rapid test kits. These rapid test kits can test for COVID-19 faster than the PCR, the polymerase chain reaction test that we have been doing. It's also cheaper. And then, so by the time they roll this out, a lot of people can do what we call some form of mass testing, so that people would know that whether they are positive or negative, so that they can self-isolate. So, and then apart from that, I also understand the federal government is expecting about 30 million doses of Johnson & Johnson vaccine. Now, this one can vaccinate about 30 million people because it's not 2 doses. So, imagine if we are able to vaccinate about 30 million people right now, it should go a long way. It will help us.
That's great news.
Do you think we have accurate stats on the number of infections and the number of deaths? And would you say that we should still be very worried concerning COVID?
Oh, yes, we should be very worried concerning COVID, despite the fact that we have a relatively lower number compared to some other countries. Well, we may not say the numbers are correct because, like I always say, right from the beginning of this pandemic, we are not capturing as much as we should. But then again, the number we have is the number we have. It's the data we are working with, and it's not as bad compared to some of the African countries, European countries. It's not as bad. But then again, we cannot defeat COVID until COVID has been defeated all over the world. Because the way it works in public health is that if you still have this pandemic, even in one country, it can spread to other countries of the world.